Congratulations. Who would have known, right? Good evening, everyone, and it's a pleasure to see so many of you here, and it's really a pleasure, and I want to thank PSS and their staff for selecting this location. It's just wonderful. My name is Carmen Morano. I'm a professor of social work at the Silberman School of Social Work, but more importantly, I am a member of the board for PSS, and I've been a member for a number of years. I've stopped counting, but as long as they invite me back, I'm really honored to serve. This evening, I have the unique pleasure of presenting the Circle of Care Award. For those of us in the field of aging, we are acutely aware of the trauma that families go through when a member of our family is diagnosed with Alzheimer's disease. And for someone like myself, who has spent the better part of his my practice career, as well as my academic career doing research with caregivers, it strikes me that no matter what we do, we have so much more work still left to be done. Currently, there's more than 5 million people in the United States that are diagnosed with Alzheimer's disease. And any of us who've worked with this population know that, while that number might be a little over 5.5 million people, for every person diagnosed with Alzheimer's disease, there's a minimum of at least one other person who is if you will, receives the consequences of that diagnosis, and that's their primary caregiver. And for many families, it's more than just one person. So when we begin to look at numbers of 10, 15 million people who are directly affected by this disease, a program like the Circle of Care and the work that they're doing here in our city is just phenomenal. And the work that they do, when you consider that right now, I think as of 2018, we're spending approximately $230 billion, that's B, billion dollars, a year just to provide care for this population. The work that PSS with the Circle of Care program is doing is just phenomenal. Not only having the honor of being a board member, I'm sorry, I just have to put this to add this to it, I've also had the pleasure of doing some research with the program. And while I bored a number of people already with the nuances of what my research is about, I'll spare the rest of you from that. It's just phenomenal to see the effect of this program is having in helping to support the caregivers and building the kinds of networks around caregivers that they really need. That adage that was used by many people and a politician who will go unnamed at this point, it truly does take a village to help provide care for an individual with Alzheimer's disease. So with no further ado, we have a video that I believe we're going to show. I'll stop my talking and we'll watch the video and then I'll present the award to this year's recipients.
PSS is a multi-service nonprofit agency. Founded in 1962, it has been strengthening the capacity of older New Yorkers, families, and communities to thrive. PSS does this in a number of ways. Our 9 senior centers help keep older adults healthy, engaged, and connected. In 1973, PSS built Fort Schuyler House for older adults in the Throgs Neck community of the Bronx. A decade later, PSS opened the Alberta Alston House, a 150-unit residence for seniors. Like our centers, its on-site programming keeps tenants healthy, engaged, and connected. Coming of Age is a national program that inspires people age 50 and older to live with passion and purpose. Coming of Age offers workshops, special presentations, and monthly networking events. The Grandparent Family Apartments has been recognized nationally. In partnership with the West Side Federation for Senior and Supportive Housing, the first apartment built specifically for grandparents raising grandchildren was opened in 2005. Services on site include support groups, educational programs, activities for the youth and their families, as well as support for older youth as they become independent adults. And then there is Circle of Care. Circle of Care helps family caregivers in all 5 boroughs. There are over 500,000 caregivers in New York City. But thanks to funding from both the New York City Department for the Aging and the New York State Department of Health, Circle of Care is there to help. We have over 20 staff dedicated to serve every borough, providing support free of charge to families struggling to care for someone who is very frail, homebound, or suffering from dementia. Circle of Care staff provide individual and family consultation, support groups, telechat, a support group over the phone, as well as webinars, information at community events, and training for caregivers, professionals, and the general public. Our joint enrichment outings are designed for both the caregiver and the family member with dementia to enjoy together. Circle of Care staff are there to lend a sympathetic ear, a warm and welcoming smile, and reassurance that no matter where you are or what you're struggling with, you are not alone. Because we have the opportunity to partner with so many outstanding organizations, PSS created the Circle of Care Award in 2017. Last year, the first recipient was the Weill Cornell Memory Disorders Program, a wonderful partner that hosted our field staff so they could meet with caregivers during their clinic appointments, as well as partnering with us on various other initiatives. This year, the 2018 Circle of Care Award goes to another outstanding organization, the Silver Dawn Training Institute. The Silver Dawn Training Institute equips professionals and family caregivers with a new way to communicate with their loved ones through improv. Co-founders Kathy Braxton and Tammy Newman have come up with an approach that is unscripted, unconventional, and unapologetic. They have been training professionals across the country with this novel approach to caregiver communication. Based on their experiences in long-term care, Kathy and Tammy developed an effective way to interact with family members with dementia, and it all starts with yes, recognizing where the person with dementia is at. Their Dementia Raw program focuses on creating connections and simplifying communication for those with dementia through the rules of improv comedy and the pillars of empathy. Tammy and Kathy worked with our staff this past fall, teaching them how to help caregivers communicate with their loved ones. PSS Circle of Care was proud to partner with them again this past week, as our staff were equipped to now train others on this surprising yet very effective approach. Thanks to Silver Dawn Institute, we may now have a new way to reach out and hopefully help others to truly touch someone with dementia. We salute and congratulate the Silver Dawn Institute, the PSS Circle of Care Awardee of 2018.
With no further ado, it is my distinct pleasure to invite Kathy and Tammy up to the podium so that we can present the Circle of Care Award. But it's your award.
Yeah, that's right. Thank you.
We never get nervous getting on the stage, except for right now. Tammy has given me the honor to thank everyone here in this room, and I'm not sure if it's because I have a cold today and I sound fabulous. Oh, because she cries. We want to thank everybody. This is truly an honor for us. We have been in business for 4 years, and up until right now, what we have done is collected Starbucks mugs as our awards for every city and town that we visited, because we, and my husband will attest to that, those are our Academy Awards that we keep. For every city that we visited and every group that we've gotten a chance to work with and every honor that we've had to help empower caregivers and their families. It is truly a dream come true for us to be standing up here and to have worked with this team, PSS, Circle of Care, 2 times now. This team is phenomenal. They bring their A game every time. And it is hard to step into empathy. It is hard to excavate those difficult emotions. And it's very different, the approach that we bring, because we ask family members, we ask caregivers to become introspective. And that can be very difficult, but they do it and they do it so well. And everywhere we've gone, I think everyone has really embraced what we bring. And Tammy, as a wonderful co-partner and my partner in crime business, brings this beautiful talent of improv that simplifies communicating like nothing I've ever seen before. So I would like to just say something really quickly. Oh no. Oh yes.
Oh no.
One of our rules of improv, one of my favorite rules of improv, is make your partner look good. And it is one of the wonderful mantras to take away and live in every single day. And that is what you do for me. You constantly make me look good. And I want to say that it's who you are, it's what you are, and how good you make people feel, including myself, that literally makes you a walking exclamation point. She is. You make me proud of myself, you make me proud of what I do, and I would not be here without you. And we would not be here without you. So we thank you very, very much, everyone. We appreciate all of your time and all of your energy that you've given us.
So I think I'm supposed to be funny after crying. Okay, so what we wanted to do, if we have a few minutes to do this, we wanted to share with you one of the tools that we typically use as we're doing training. So why don't we use this space right here. So I have a couple of people that have been very willing to come and help me. Oh, look, Remus is jumping up already. That's fabulous. So once you adjust that camera, come right up here. And then I have, come on. Okay, so I know that there's a few people that want to help me. I know John wants to help me. So John came in from Jersey, come on down. Oh, look, there's someone raising their hand in a red shirt. Come on down. That's fabulous. Okay, so I've got 1, 2, 3. You know what, I might do 2 more.
Oh, okay.
I might do 2 more. I think I might ask Catherine Martinez to And I'd like to ask one more person up here. Is that okay?
Absolutely.
Okay. I would like to ask Schuyler to come up here. Come on down. Okay, so as you guys know, we use improv and we teach the rules of improv as a way to communicate really seamlessly with persons living with dementia. So we consistently are doing improv games throughout our training to really prove points, is what we're going to do. So we're hoping that the 5 of you will prove a point for us tonight. Okay? No pressure whatsoever. Okay. So what we're going to do is something that we refer to as the one-word story. So what that means is this group collectively is going to tell a story 1 word at a time. Okay? So Kathy and I are going to demonstrate what that might look like. Can you hear us without the mic?
Yes. Good.
All right.
All project well?
Yes.
Wonderful. And this will go, then you have to project, okay?
Okay, I want to turn this off real quick. Okay, cool. Here we go.
We're going to give an example of what the one-word story looks like. I think you ladies probably know what this is.
Okay.
Yesterday,
we
went
to
the
store
and bought chicken,
noodle
soup,
and
crackers,
and
chocolate
whoopie
pies,
and
ate
them all night.
long.
Exclamation point! So each person is responsible for one word in the story, okay? So here comes the very small interactive part that I need from the audience. You guys ready? Okay. Give me an occupation. Just yell it out.
Teacher.
Teacher. Who said that?
Me.
That was quick. So we got teacher. Let me have an animal. Yell it out. Lion. Did I hear llama? Lion. Okay. Lion?
Lion.
Okay. So I want this group to tell us the story of a teacher lion. Okay. Shaina, you're up first. You get this going.
To project.
Project.
Everyone can hear. Okay. Yesterday,
Roar.
Cried.
Alone.
but
A cub.
Was.
Lost.
At.
lion,
Zoo.
So.
She.
Went.
to
Zoo.
To.
See.
my
Mama.
Lion. Teacher.
Mama teacher.
So.
We
can
eat
Vegetables.
Okay. Okay, typically what I like to do after a story happens is I like to summarize what was said. Okay. I'm not exactly sure how to summarize this story about the teacher lion and the cub and vegetables and there's a cub in there.
I can see
I'm
why
not
you
sure.
ran away though.
Yes.
Mama wanted to eat vegetables.
Right. What lion wants to eat vegetables?
Exactly, yeah.
Absolutely.
There's a lot of control freaks in the
There's a
audience.
lot of control. I think this is the most amount of control we've ever had in one place.
No, this
I'm not ashamed of that.
No, they're not. They're like, yes, we are control freaks.
How would you know?
Yes, New Yorkers.
Yeah.
So typically we do ask the group that is up here, we ask them a couple of questions. So the first question I think I want to ask is, how was that for you, Remus?
I loved it. No, it was good. It was interesting to see where the story was going and trying to keep up.
Catherine, how was it for you?
You didn't know what was next.
Yes. She did it. She did it. That is true. That is true. That's a great point. So one last question for all of you. What is more important to make this story a success? Coming up with the right word or listening? Come on, control freaks. What is it? Let's give them a round of applause.
We like to use that as an example. The one-word story is something that leads us into one of our rules of improv called relinquish your agenda. And if you came up here, if any of those people came up here thinking they knew what they were going to say, they were sorely mistaken. They had to relinquish their agenda to allow that story to continue. And that is one of the things we believe very, very strongly, not only about the rules of improv, but this game alone. It very simply brings that concept to everyone's mind without us having to lecture. And we can do it while we're having fun.
Absolutely.
And there's so much information that comes out of that because we do have to wait. We have to learn to be patient. And we always have to relinquish our agendas whenever we're working with someone who's living with dementia or their caregiver.
Absolutely. So thank you so
Thank
much. I'm just going to say really quickly, thank you. Thank you, thank you. PSS has been such a fabulous community for us to be a part of. So thank you.
Yeah, we're New Yorkers at heart. Thank you.